Today I'm going to be administering an IV infusion based on the 6 rights of medication administration. Right med, right dose, right patient, right date or time, right documentation, and right route. So the first thing I'm going to do is I'm going to go ahead and go to my computer, and I see an order on my MAR from Dr. B to administer 1,000 mils of continuous saline over, or 8 hours continuous, excuse me. So I'm going to go ahead and do my calculations. And I calculated that out to be 125 mils per hour, which is a drip rate of 21 drops per minute. So the next thing I'm going to do is I'm going to go ahead and wash my hands after I've checked that order on the MAR. And it is for Bob Johnson in room 102. And the start time is 1300 or 1 o'clock. So the next thing I'm going to do is I'm going to go ahead and pull my saline. So I'm going to see that this is 0.9% sodium chloride, and so this is the right medication that we are administering today. I'm going to go ahead and open that bag. So the next thing I'm going to do is I'm going to go ahead and check my bag for any particulates, discoloration, and then expiration. This bag is expired January of 18. For this video, we are going to use it. However, if this was a real life situation, I would toss this and get a bag that was not expired and that did not have a little bit of this yellow color that this bag does have. So the first thing I'm going to do is I'm going to go ahead and label. I have already pre-made a label. And I'm going to label the bag on the back side of the bag so it doesn't interfere with any of the graduation on the front. I'm going to label it with the start date of the infusion, which is the 1300, and then my discard time, or my end rate of infusion, my end time, and then as well as my initials. So I'm going to go ahead and apply that to the bag. The next one I'm going to apply that I've already pre-made is my infusion rate time strip. So this just gets applied to the bag. It helps you kind of identify where you should be at each hour. Again, it has the date of today, the start time, the infusion rate of 125 mils per hour, which is the same, and the drip rate as well, 21 per minute. I'm gonna go ahead and peel that off. Just gonna check and make sure where that starts. Go ahead and apply my strip. Sorry about that. Okay. Perfect. All right. So now that that's done and I have washed my hands, this just seems to be easier. I'm going to go ahead and apply my gloves. It's very hard to apply stickers with gloves on because the stickers stick to the gloves. So again, I've already checked that with the MAR that this is the right solution, the right patient, and I have my labels already made. My next step is to go ahead and remove the tubing. So I have selected, this is a 10 drop per mil, which is the appropriate tubing for the solution that we are administering. I would get a clean one of those because I just dropped it in the garbage, but yes, it is still sterile. So this is a continuous flow solution set, which is the correct one. I'm going to go ahead and open that. So again, with this bag, you want to make sure that it's not ripped or anything like that, that the bag hasn't become contaminated by any means. When you take out your tubing, you want to make sure to look for any cracking in your tubing, any discoloration in your tubing, if anything doesn't seem right. This one is definitely a little funky colored, but again, it is within the right date, but I would compare this maybe to another set just to make sure that this color is normal for this tubing, and if not, I would toss this and then get a secondary set. So the next thing I'm going to do is I'm going to close my roller clamp, and that just helps prevent us from having a mess. Again, I'm going to go ahead and do this secondary safety just because sometimes stuff breaks. Getting kind of used to that. All right. So I'm going to take my bag And then maintaining sterility the whole time, I'm going to go ahead and pop this off, the tube for that, and then I'm going to go ahead and pop off the cover for my spike. I'm going to get that in there. You want to make sure this is in here nice and snug, otherwise you're going to have a mess. I'm going to go ahead and flip that bag, and I'm going to hang it up. So the next thing you want to do is you want to fill your drip chamber. This one does have a line, a little bit of a line there, but you want to make sure it's just about halfway. Okay, so now that that is halfway, I'm going to go ahead and prime my tubing. And you want to do this just so that you don't get any air bubbles or anything like that into your patient. So I just kind of spaced out a little bit. I'm going to undo this first clamp. And then I'm going to go ahead and take my roller clip. You want to leave the protective cover on so that you maintain sterility of this. So we're going to go ahead and let it open that wide up. And we will prime this tubing. Just want to make sure I get all those little air bubbles out of there. All right, and that looks good. So I'm gonna go ahead and close back the clamp. Perfect. And then again, the secondary safety one here. And then I'm going to go ahead and make sure to take my tubing and hang it over so that when we take it into the patient's room, we don't want it dragging on the floor. We want to maintain its sterility. And we want to make sure the clamp is all the way down. So all of that looks wonderful. We have the secondary and that. So that's hanging up there nice and safe. The next thing I'm going to do is prepare the rest of my supplies. I do actually need to label my IV tubing so that, I mean, some medications require different times for the tubing to be changed. So we just want to make sure that that is on there so that if somebody does come in, the start time for the infusion is there, the date we administer it. I also put Bob's name and date of birth on there just so that if anything does happen, we know that where it came from. And if you do see something like that and it's not in the right patient's room, you should just throw it away and start new. But that just kind of protects us. So after that is on there, I'm going to go ahead and prep all my supplies that I need to take into the patient's room. I'm going to take in some gauze pad in case there's any bleeding, my tourniquet, a flush, a saline lock, a transparent Tegaderm for over the IV site, my 20 gauge needle, which I'm selecting based on what we are infusing, our medication, and the patient's age. So we want to make sure that that's the correct thing. I'm taking some alcohol pads, and then I am also taking some different types of tape to secure some stuff down. I will then take my gloves off, clean up my station, make sure that everything is put away, no patient identifiers are left out. I'm going to wash my hands, and then we are going to take all the supplies and the IV bag with us on this IV pole into the patient's room.